Hi, welcome to my channel. I'm Mrs. Ezine, and this channel is catered to helping students succeed in university. For this video, I'm going to be specifically teaching an online lecture on contemporary issues to public health. It's specifically made for public health students. So do well and subscribe. Watch my other videos, tutorial videos to help you in the university. But let's go on with our online lecture, and don't forget to hit the like button and leave a comment below if you have any question concerning this lecture. Also, don't forget to subscribe to this channel. Thank you. So once again, it's introduction to contemporary issues in public health. Now, the word contemporary means something occurring in the present, something current, present, happening now. So what are the issues that are happening now in public health? Now, the concept of contemporary is used to convey what is present and current in the society. It is used to being it's used to describe being in fashion or up to date and modern. So what are the modern issues we are facing currently now in the world? Okay, for example, we have socio-economic inequalities in health have remained current in the UK despite a rise in relative living standards. Dietary fads come and go in short bursts of lifestyle fashion, infectious diseases and virus carrying hosts coexist with society despite great strides in pharmaceutical therapies. So no matter how far they have gone, they have new issues that have come up now in our society. Take for example, we have COVID-19 that just currently came up, which is an infectious disease, and we are still battling it up to now. So the WHO has listed urgent health challenges for the next decade, that's for the next 10 years. And experts around the world came up with this list of the health challenges that we are facing or we are going to face in the next decade. There are about 13 to 15 of them. And of course, it puts our lives, livelihood, and economies in jeopardy. None of these issues are simple to address, but they are within reach. So we have to, as public health professionals, officers as well, we have to join hands with other bodies to curtail these health challenges that have come our way presently. Okay, all the challenges in this list demand a response from more than just the health sector. Okay, so we face shared threats and we have a shared responsibility to act. So you won't just say it's only for public health or it's only for doctors. No, we come together, both the health sector, the agricultural sector, the housing sector, and all that. We come together to face this threat and overcome it. With the deadline for the 2030 Sustainable Development Goals (SDGs) quickly approaching, the UN has underscored that the next 10 years, next decade, must be the decade of action. We have to stand up and actually fight these health challenges that come our way so that we can overcome them. Now, the challenges that we are going to look at now are not listed according to priority. Okay, so all of them are urgent and many of them are interlinked. So let's go on. So the first one is elevating health in the climate debate. What is the challenge in elevating health in the climate debate? Okay, so climate crisis is definitely a health crisis. Air pollution has been estimated to kill 7 million people every single year, while climate change causes more extreme weather events, exacerbates malnutrition, and fuels the spread of infectious diseases such as malaria. So if you know that malaria is spreading more and more, of course malaria is linked to the increase in the rate of malaria is linked to climate change. Okay, some places that were not experiencing hot weather compared to some places that were experiencing hot weather before are experiencing it more now, and so the mosquitoes definitely thrive, they enjoy the hot climate, and definitely will go towards places that have such climate. Okay, the same emissions that cause global warming are responsible for more than 1/4 of deaths from heart attack lung cancer and chronic respiratory disease. So the more we have these emissions, the disease, the incidence of this disease is going higher. So leaders in both the public and private sectors must work together to learn how to clean up our air. Especially here in Nigeria, we have not even reached that, but in the developed countries such as the UK and the US, they have gone far in mitigating the health impacts of climate change on our health. Okay, so next is delivering health in conflict and crisis. What's the challenge? In 2019, most disease outbreaks requiring the highest level of WHO response occurred in countries with protracted conflict. Okay, for example, here in Nigeria, we are dealing with Boko Haram conflict crisis. Okay, and of course, when there's war, there's conflict, definitely disease outbreak is likely to occur. Okay, so we also saw the continuation of a disturbing trend in which health workers especially are targeted. WHO recorded 978 attacks on healthcare in 11 countries last year with 193 deaths. At the same time, conflict is forcing record numbers of people out of their homes. They are being displaced, leaving tens of millions of people with little access to healthcare, sometimes for years. How long will it take them to come back to how they were before? It takes a long time. See, Boko Haram, we have been fighting Boko Haram for almost 10 years, going to 10 years, I don't know, and we don't even know when it will stop. Now, talk about the people that have been displaced from their homes in the period of time this has occurred. Number 3, making healthcare fairer. Making healthcare fairer. This has to do with health inequality. So the challenge here is that there's a persistent and growing socio-economic gaps result in major discrepancies in the quality of people's health. There's not only an 18-year difference in life expectancy between the rich and poor countries. Okay, for example, now Nigeria is owing in debt, in billions of debt. You can't compare it to the US or the UK. Okay, so there's an 18-year difference in life expectancy between these rich and poor countries. Meanwhile, the global rise in NCDs, that's non-communicable diseases such as cancer, has a proportionately large burden in low and middle income countries such as Nigeria, and quickly drain the resources of poorer households. So number 4, expanding access to medicine is another urgent health challenge. About 1/3 of the world's people lack access to medicine, vaccines, diagnostic tools, and other essential health products that are out there. Imagine people living in rural areas. They can't access these things that are essential for their health. So low access as well to quality health products is one thing to have health products, and it's another thing to have quality health products. There are a lot of people that are producing drugs that are not up to standard, and because people cannot get the right drugs they need, they settle for the lesser ones, which is so wrong and will not reduce the incidence or the prevalence of this disease in their area. So it threatens health and lives, which can both endanger the patient and fuel drug resistance. We are coming to that. So medicine and other health products are the second largest expenditure for most health systems after health workers. So health workers are the most necessary, or the first largest expenditure for health system, and the next is this medicine that we are using to cure diseases. And the largest component of private health expenditure in low and middle income countries are this medicine and health products. Okay, they cost a lot of money. Just take for example the different ones we have, especially for NCDs that are coming up now. They're really expensive, and people are trying to get access to it and don't have that privilege. So number 5 is stopping infectious diseases. Stopping infectious diseases. We're trying to stop polio, and we're trying to stop other things as well, other infectious diseases, and now we have come and we faced COVID-19, a very, very life-threatening infectious disease. But we are saying we're really happy that we have moved forward and we are really coping with this present challenge. Now, infectious diseases like HIV, which still has no cure. We have tuberculosis, viral hepatitis, malaria, NTDs and STIs will kill an estimated 4 million people in 20, has killed 4 million people in 20, and most of them are poor people because they can't access this medicine because of the health inequality that we are facing. So you can see how these challenges are interlinked with one another. So meanwhile, vaccine preventable diseases such as polio continue to kill, so like measles, which took 140,000 lives in the year 2019, many of them of which are children. Of course, under fives are more at risk of getting such diseases than other people. Although polio has been driven to the brink of eradication, there were 156 cases of wild polio virus last year, the most since 2014. Can you imagine that? The root causes are insufficient levels of financing, back to the finance, back to the economy, back to the money, and the weakness of health systems in endemic countries, coupled with a lack of commitment from wealthy countries. Okay, so we have malaria, which is still prevalent here in Nigeria, and we have said we have stopped polio, but once in a while we see some 1 or 2 cases. We are not even sure of if they have really stopped polio in Nigeria. Of course, if you're in Nigeria, you know what I'm saying, right? So let's move on to 6, preparing for epidemics. Now, COVID-19 is not an epidemic, for example. I'm referring to COVID-19 because that is what is happening right now. It's a pandemic because it's happening all over the world. Okay, so the challenge is that every year the world spends far more responding to disease outbreaks, natural disasters, and other health emergencies than it does preparing for and preventing them. So it's when it occurs we take action rather than taking action before it occurs, thereby preventing it from occurring, and also we don't prepare for them. So we have to prepare for epidemics. A pandemic of a new highly infectious airborne virus, most likely a strain of influenza, for example, or COVID, to which most people lack immunity, is inevitable. It is not a matter of if another pandemic will strike, but when. And when it strikes, it will spread fast. And we saw that with COVID-19, the way it moved from China or Asia down to all the countries had COVID-19. Okay, it will spread fast, potentially threatening millions of lives. A lot of people died and will die because of a pandemic. Meanwhile, vector-borne diseases like dengue, malaria, Zika, and the rest are spreading as mosquito populations are moving into new areas fanned by climate change. Like I explained in the first one, climate change is helping the mosquitoes to move, to migrate, and as they migrate, the disease is migrating with them, if you get what I mean. So it's a very, very big problem. Protecting people from dangerous products. Okay, so lack of food, unsafe food, and unhealthy diets are responsible for almost 1/3 of today's global disease burden that we are experiencing. Hunger and food insecurity continue to plague millions of people, with food shortages being perniciously exploited as weapons of war. Especially people who have been displaced, they can't really access the food, and thereby they go on a hunger strike. So at the same time, people consume foods and drinks that are high in sugar. Okay, we have the problem of overweight, obesity, and diet-related diseases. Okay, so meanwhile, tobacco use is declining in a few but rising in most countries. Okay, some of them are able to bring it down, and some is just not being curtailed at all. And evidence is building about the health risks of e-cigarettes. Okay, so let's move on to the next one. Investing in people who defend our health. Who are the people who defend our health? Us, public health professionals. Okay, we also have doctors, we have nurses, and other people in the health sector. So chronic underinvestment in the education and employment of health workers, coupled with the failure to ensure decent pay, has led to health workers shortages all over the world. We know that right now in Nigeria, a lot of doctors are migrating outside. They are migrating outside to better countries because they pay them more than what they get here in Nigeria. So this oh my god, this jeopardizes health and social care services and sustainable health systems. The world will need 18 million additional workers by the year 2030, and mainly in the low and middle income countries, including 9 million nurses. And so next is keeping adolescents safe. More than 1 million adolescents, which are between the ages of 10 to 19 years, die every year. 1 million. 1 million. Now, the leading cause of death, of course, is road injury. We have HIV, we have suicide, which is the third, and we have other things as well. Now, we have harmful use of alcohol, tobacco, and drug use, lack of physical activity, unprotected sex, oh my God, and previous exposure to child maltreatment or increase the risk of this, and it leads to death. It can lead to death. Okay, you know how adolescents they begin to explore and all that, so they can start exploring tobacco, cigarettes, and all that, and from there they get addicted to them, and this leads to different problems, especially road injury. You see them taking alcohol and going to drive, for example, and in countries where their laws are not very strict, or they're having problem with keeping up to date with all these things, they go ahead and involve themselves in road accidents, even killing other people as well. So number 10 is any public trust. Oh my God, we saw this during COVID-19, and we are still experiencing it here in Nigeria. Some people haven't still taken their COVID-19 vaccine, for example, because they doubt it's the real thing. So trust helps to shape whether patients are likely to rely on health services and follow a health worker's advice around vaccinations, especially. That is where the major problem is. Then taking medicine or using condom. Public health is compromised by the uncontrolled dissemination of misinformation. We saw a lot of that on social media last year. We saw a lot of that, and we keep seeing them. Just imagine when they say Ebola and they said you should use salt on your body and Ebola will disappear. Oh my God, that was horrible. So as well as through an erosion of trust in public institutions. For example, the anti-vaccination movement has been a significant factor in the rise of deaths in preventable diseases. Some people don't support the use of vaccine. They say, for example, they said they are going to put a microchip in the vaccine and stick it into our body, and we should not take the vaccine. Come on, really? So how are we going to prevent the disease if we don't do something about it? So next is harnessing new technologies. New technologies are revolutionizing our ability to prevent, diagnose, and treat many diseases. Okay, so we are moving forward. We have genome editing, synthetic biology, and digital health technology such as AIs, which can solve many problems, okay, but also raise new questions and challenges for monitoring and regulation. Without a deeper understanding of their ethical and social implications, these new technologies, which include the capacity to create new organisms, could harm the people they are intended to help. Okay, so it's still a new area that we are looking into, and we have to be sure before we use these things that they are not going to harm people, especially when you are trying to help them. So next is protecting the medicine that protects us. Now remember, I talked about drug resistance before, and so we have come to it. We have antimicrobial resistance, which threatens to send modern medicine back decades to the pre-antibiotic era. That is so scary. Even when even routine surgeries are hazardous. Oh my God, do you imagine if you are trying to cure a particular disease and you take medicine for it, a drug for it, and it doesn't work? How are you going to cure that disease? How are you going to stop it? And of course, it leads to death. Now, there's a rise of AMR stems from myriad factors that have come together to create a terrifying brew, including unregulated prescription and use of antibiotics, lack of access to quality and affordable medicine, and lack of clean water, sanitation, hygiene, and infection prevention and control lead to this rise of AMR. And it's a very big challenge that we have to conquer. If not, we are in serious trouble. So keeping health care clean is the next one. Roughly 1 in 4 health facilities globally lack basic water services. There are a lot of facilities, primary healthcare facilities down in the villages that we have here, that don't have water, especially the clean water that we need to thrive in good health. Now, the lack of these basics in health facilities leads to poor quality care and increased chance of infections for patients as well as health workers like us. Now, all of this is happening against a backdrop of billions of people around the world living in communities without safe water to drink or adequate sanitation services. There are a lot of schools that don't have enough water, and in these schools they have children who are highly susceptible to diseases. So both of which are major drivers of disease, and we have to curtail it as well. Now, there are 13 that we have looked at here, and so we move on to the last slide, which is the top 10 causes of death in Nigeria. Remember, it's contemporary issues in public health, and this is just an introductory lecture to it. So according to the Center Disease Control, that's the CDC, in Nigeria, the following are Nigeria's top 10 causes of death as of 2018, and we are still looking at it now. So the first one is the lower respiratory infections. We have neonatal disorders, we have HIV and AIDS, which we are still battling all around the world. We have malaria, which is an endemic disease here in Nigeria. We have diarrheal diseases, especially attacking our under 5 children here in Nigeria. Then we have tuberculosis as well as meningitis, and we have ischemic heart disease, stroke, and cirrhosis. Oh my god. Anyway, so these are the top 10 causes of death in Nigeria, and we are presently attacking them now, and we hopefully will overcome them before the next 10 years. Okay, so it's not really easy for us as health workers, but we know that if we combine our hands together with other sectors, and we are very determined, that we will overcome these challenges. So this is just, so we have come to the end of today's lecture, and don't forget to subscribe and click that notification bell so you'll be notified of when the other videos will be posted, because this is the very first video on this course, Introduction to Contemporary Issues in Public Health. So do well to leave a comment below if you have any questions or any comments to make concerning this particular lecture, or you can always send me an email or chat me on WhatsApp if you have my number, or send me, or also join my Telegram support group as well. Okay, so thanks for watching, and do have a blessed day. Bye.